Hey everyone, how's it going? Again, my name is Vanessa Lathan. I'm the Grassroots Advocacy Manager here at AiArthritis, and I wanted to give you an update on the policy workshops that I attended at ACR on day 2 and 3. Before I get to that, I do want to let you know that while our overall organization is a small but mighty team, our policy team is even smaller with just myself and Mark, and we had one of our coalition meetings that was in person that I attended that is working on transparent and affordable prescriptions or medications. So really wanting to make sure that patients are easily able to access their medications at a good cost. And that was a great in-person coalition meeting because often in the virtual world, we don't get to meet in person. So it was good to connect, get updates on federal policy. We know right now that the government shutdown can have a great impact on patients right now and for weeks, maybe even months, years to come. We also talked about some state policy updates, looking forward to growing that coalition to really include other health conditions like oncology, cancer, heart conditions, mental health, because medication affordability and access is really across all health conditions. Now, going back to the policy workshops, they were really an open space for rheumatologists mainly, and any healthcare professionals, healthcare providers, and researchers to ask any questions they had around policy, particularly to hear what the ACR's policy team was doing about that issue. One of the things that came up a lot were that small private providers feel forgotten about. They feel that if you're not a rheumatologist attached to a large medical system, you're not receiving the support that you need, and that small private rheumatologists are dying out. They don't have support, they have high overhead, they're not getting reimbursements that they need, and they were very concerned. The ACR shared that private rheumatologists are one of their top priorities to advocate for, to make sure that they stay alive. And even the incoming president of ACR shared that this is very important to me and that private rheumatologist is the heart of the rheumatology field. Another thing that came up was environmental health. A rheumatologist shared that she thinks that the ACR needs to be addressing environmental health. And while overall with that concept, the ACR agree, they said it's very nuanced, right? And that there are other organizations that are more focused on that and they will yield to them taking the lead versus ACR taking it on themselves, because there's so many other topics to cover right now in healthcare, because we're living in shambles a little bit right now, but they did recognize that it's nuanced because what one city, one town, one county, one zip code, one state, one region, one area may be experiencing related to environmental health may not be the same in another zip code, another state, another county. But they recognize the importance of addressing, improving environmental health because that overall impacts patients. Hearing these conversations just reminded me that we all show up with different lived experience. No one patient, no one rheumatologist, no one healthcare provider, doctor has the same lived experience, has had the same journey, is passionate and focused on the same advocacy needs. And there's all things that are important to us all. And I want all of us to keep that in mind as we advocate for things. Those that know me, in every conversation that I am in, I bring up health equity. I recognize that people that look like me, people of color, underrepresented communities are often not at the table, but really disproportionately impacted by a lot of chronic health conditions, a lot of policies where our voice doesn't seem to be heard, our input is not understood. So when I was listening to the conversation of the rheumatologists and everything that they were sharing that was important to me, it was just like, wow, these spaces are needed. Safe spaces to share, hey, this is the challenges I'm experiencing. Hey, this is what's going on in my state. And the ACR shared that this is what these conversations are about, because they can't keep up with every single federal, state, and even local issue. We had a rheumatologist from New Hampshire share that she knows people in her state that their private insurance is being changed without them recognizing. The ACR didn't realize that was happening. While gout is not an AiArthritis autoimmune condition, there were providers talking about the need to improve medication access for gout, as well as improve costs. This is also a reminder too, as a person living with a smaller autoimmune condition, that we have to come together. While I will always say advocate for yourself, advocate for your health condition, and remember that there are so many other autoimmune conditions and autoinflammatory diseases that need to be advocated for. So while you're advocating for yourself, maybe talk about a smaller, less known autoimmune or autoinflammatory disease, because we all need help. We all need resources. We all need better access to medication, treatment, and costs. Lower the cost to receive that access and care. Lastly, one of the things that I will share that the ACR shared about how you can get involved right away is to know who your local, federal, and state representatives are. Like, who is representing you on all three levels. It's important to know those. We're gonna drop a link. We'll have them put it within the resources. So for those in the United States to be able to know who your representatives are, because the ACR said that while they are working with Congress and sending letters and writing statements, that your representatives want to hear from you, their constituents, the people that elect them, the people that vote for them, or the people that they represent. They want to hear from you. And we have to be consistent in reaching out. Once a month, every other month, send a letter, call, go to the local office of your representative, whatever works for you. Add them on social media. We have to be loud about our issues because there's so many issues going on. We just talked about environmental health. There's so many other things that our policymakers have to worry about, but we have to be at the forefront of their mind that healthcare access and cost is important, and that their constituents who live in their state, their county, their district, their zip code are worried about this. So they want to hear from you. So ACR and even AiArthritis, we need your support in advocating for these health issues so that we can have better access to treatments as patients. And more than anything, take the patient away. We are still a human and we deserve a better quality of life. They also said vote. Vote, 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 vote. Not just in major elections, not once every 10 years, not once every 20 years. The ACR wants you to vote every year in every election, whether it's just at the local level, state and federal, you have to vote. And I know I said that was the last thing, but I just thought about one more thing that I do want to share that doesn't directly impact patients in a way, but it does, is that right now there are a lot of changes happening to student loans, and that includes medical school. And if it is hard to access student loans, and if it's hard to receive money to go to medical school, and medical students have to rely on private loans, we could see a decrease in medical students choosing rheumatology as their field that they want to study, which would then add to an already healthcare doctor workforce shortage for the foreseeable future. So that is something that needs to also be on our radar. A lot of us share that it's hard to get an appointment with our doctor. It's hard to, if you want to change doctors, all the things, it's hard to get in contact with them, get an appointment. Well, that could get worse if we don't have doctors available to see us. And maybe your area has rheumatologists easily accessed, meaning that there's a lot in that area. We have to think about people who are living in rural communities or communities where health centers, hospitals, things are shutting down. So there's a lot that we have to advocate for. We have to come together. We have to stay strong. I know we are living in hard times. So I will say that while, yes, we need to advocate. Yes, we need to be using our voice because our voice has power. We are enough. We are the voters, the policymakers, the legislators, they work for us. I want to also say take care of yourself too. Life, policy, turning on the news can be very overwhelming. It can be very scary because we are living in very hard and sad times. And I know with all the challenges happening right now to healthcare, Medicare, Medicaid, that it can be very scary. So take time for yourself too. And when you feel ready, whatever advocacy looks like for you, having a conversation with your rheumatologist, putting a post on social media, writing a letter, calling your representative, do it. And you never know what that can get you, as I shared in my last video. That one phone call could lead to you giving a speech somewhere 5 years from now. And you wouldn't have known that you could get there if you didn't start now. And I keep saying the last thing, but I keep thinking of other things I will add. Doctors also shared their concerns about Medicare Advantage plans and how choosing them can make it difficult to have access to a doctor and then receive the treatment that you need. And they were advising against choosing Medicare Advantage plans, and as best as you can as patients, research before you choose certain insurance plans, which I know is easier said than done. But AiArthritis, we're here to support you in that, and we're a safe space for you to ask any questions that you need to ask. As the saying goes, the only incorrect, wrong, dumb question are the questions not asked. So that means ask any question that you need. Any question that you need to ask, because we are here to support you in every single way in your healthcare journey. With that said, I thank you so much for coming along with us on this journey. I know that this conference is not centered around policy, but they're trying to have the conversation because we need everyone involved in this. Every single person, from the rheumatologist on down to the patient, and even your family members and friends around you. Get them involved in advocacy too, because this impacts all people. Because I like to say we're all patients, because at one time or another, we need to see a doctor, we need to go to a pharmacist, we need to access medication, and we need to be able to afford to access that medication or afford to be able to go to that doctor's appointment. So let's keep up the good fight. You all are doing amazing work out there. Thank you for all that you're doing as being an advocate, for showing up despite every symptom, every misdiagnosis, every unanswered question that you have. I thank you for staying committed, because being a patient is not easy. I wish you all well, and I look forward to seeing you in the next Go With Us. In the meantime, please check out our public policy department, and let's be loud and proud and letting them know that patients are here to stay, and we demand better. And that's that on that. Bye!